Hello, everyone. My name is Juan Espinosa, Director of Student Success here at the UCLA School of Nursing. Thank you for joining us today for our alumni lecture for this winter quarter. Our alumna, Susan Moon Labriola, is an advanced oncology certified nurse practitioner specializing in gynecologic oncology care. She's deeply committed to empowering patients through education, lifestyle-focused interventions, and collaborative care. Ms. Moon earned her Bachelor's of Science from Pacific Union College and her Master of Science in Nursing from the UCLA School of Nursing. She has over a decade of experience in hematology and oncology, followed by more than 9 years of dedicated service at Kaiser Permanente Sunset Medical Center. Her clinical philosophy is rooted in patient-centered care, emphasizing clear communication through documentation and shared decision-making to achieve the best possible outcomes. Outside of the clinic, Ms. Moon enjoys hiking with friends, training for running races, playing the piano, and exploring new recipes in the kitchen. Alrighty, Susan, go ahead and get started.
Hello. Hi, everyone. Um, I'm so excited to be here and talk to you about new residency programs here. And we are going to discuss main hospitals in LA, such as UCLA, USC, Keck, Cedars-Sinai, and Kaiser Permanente. And we'll talk about briefly how to navigate in private medical groups as well at the end. So as we we are going to learn about what nursing residency program is and compare all these four programs in LA, in Los Angeles County, and identify programs that fits your need and understand when to begin preparing and applying. So what is the nurse residency program? It's a structured transition from student nurse to professional RN. And it takes time, obviously, and it's paid. It's a full-time RN employment. What's different is that you are going to be with mentor or supervision, and that you will be supervised, and it can be unit-based or track-based, and is supportive, safe, and confident practice. So why nurse residency program matters? Nursing career is very exciting career, and you will be able to get a job any place, anywhere, despite recessions and changes in economics. And in order to build that confidence and clinical judgment, you need to you need to navigate that complicated healthcare system safely. And in order to do that, you need that certain period of learning curve, learning experience that you will become a competent nurses in a hospital setting or clinic setting to improve patients' outcome overall. So let's compare UCLA health residency program first, since we are in UCLA program. It's 12 months program. It starts in winter and summer, and it's academic medical group and focus on leadership, evidence-based practice, and excellent in care. You can actually Google UCLA residency program, and it tells you all about this as well. So is monthly residency education days provided, dedicated unit preceptors and mentors, and clinical nurses, specialists, and educators. The support is well-structured and academic setting year-long residency. USC is shortest residency program we have here. It's 12 to 16 weeks, so about 1/3 of other residency program. And it's a rapid transition to independent practice. It requires you to have a RN license. It's a faster and immersive transition. It's one-to-one preceptor model, and in classrooms and clinical integration as well. Now, Cedars-Sinai residency program is a 12 months program, and it's a broad clinical exposure and flexibility. If you log on to Cedars-Sinai residency program, it doesn't really give you specific dates. And I have the dates here. We'll discuss this and then we'll get into the specific days. So it often begins in mass surge, but they go into critical care and women's health and operating room rotations as well. It's paid hourly and it's a broad exposure and adaptability. Now, Cedars-Sinai in 2026, they have a spring and summer residency program. Spring application begins in March 2nd, 2026. It starts on May 18, 2026. And summer program starts August 24, 2026, and application opens in June 15 of this year. And you must have an RN license at the time of application and completion of your nursing education. So now Kaiser Permanente has a residency program as well. It's a 12 months and it's a track-based program. Whether the specialty you're into, whether it's pediatrics or research or critical care, you specialize the experience and mentors get mentors in that field. So safe transition and professional development and system-based care. Same thing, strong mentorship and large integrated system with a strong training support. So side-by-side program comparison is the program length is 12 months at UCLA, Cedars-Sinai, and Kaiser. USC is the shortest, and most of them are unit-based or float and unit, but Kaiser, as I explained, is a track-based and best fit for leadership and depth at UCLA, quick independence at USC, and Cedars-Sinai is a flexibility, and Kaiser an integrated system. So all these programs requires graduation from nursing program, which you guys don't have to worry about, and California RN license and BLS certification. Now, if you already worked, 2-3 years as a RN, the residency program is not applicable for you because the experience limit at UCLA is less than 6 months, USC less than a year, Cedars-Sinai 9 months, and Kaiser 6 to 12 months. So it's really good for you to be able to prepare this residency program, maybe get a job and see, which area that you might be interested in for 3 to 6 months while you prepare for this residency program. And prepare early when you're in school, when you're studying for your RN license. Establish a relationship with your professors, your clinical mentors, and talk to them about, you're interested in applying residency program, and that ask if they are able to give you some recommendations and whatnot. So it starts like a year or at least 6 months prior to your graduation and applying for your RN license. And program fit matters rather than, big names, what you're interested in. So apply broadly. The next slide says, no single best program. The fit is the key, and consider learning pace and support needs and long-term career goals. And like I said, starts right now. When you ask for recommendation letters, and most of residency program requires 2 recommendation letters, and reach out to people that you got used to know or work, and ask them whether they would be able to write recommendation letters. And rather than have them to write from clean slate, prepare a letter for them and send it to them in a format that they can edit so that they can, put their recommendation or some specific sentences for you, but they don't have to start from the dates and your name and your address and all that. Make it easy for them so that they can take, less time, or they can concentrating on giving you a good letter rather than writing a whole page. Oh, and once you get into this residency program or interviews, I want to tell you about common mistakes for interviews. Now, you may want to go into interviews and say, I'm so sorry, I'm a new grad, I don't have any experience, and apologizing for being a new grad. They know you're not experienced. That's why you are applying for a residency program. Or even if you apply to just private medical group, you are a new grad and they need to give you some supervisions and mentorship. So you bring what's valuable as a new grad: enthusiasm and want to learn and being a team member. That's what you bring to that interview. Also, please do come and prepare about the employer's background. You don't want to show up to the unit or interviews not knowing their organizations or their mission and patient populations, and try to avoid talk about money. The residency program or most of RN pay scales are all public pay scale, and there is not much negotiation there. Once it depends on your experience. In most hospitals nowadays, you start based on your experience and you go from there. And if you had any negative experience about school or past experience, that's not the place you want to talk about. They want to see something positive. And even if they ask, what is your weakness? You want to say the weak part of your experience and something turn into positive. Like, I was not familiar with this patient population, and I learned from that experience, and now I am more in tune, or I pay attention so that I don't repeat that mistake. All right, the next one. Oh, and there's no question that's stupid. You're only stupid if you don't know and you don't ask. So any question, if you have any questions, feel free to ask them, but make sure that they don't have to tell you twice. You carry a small notebook in your pocket all the time. And if they tell you once, that should be enough for the next 2-3 years or in your career. And when it comes to patient safety, there's no shortcuts. So you make sure, if you're not certain, you ask, you look, and you research, Google, whatever you need to do. Do not compromise patient safety. When you think that something is not right, listen to that gut feeling. Also, if you're in a hurry to finish your charting on Friday afternoon so that you can clock out and start your weekend, please do not rush finishing charting or medication refills, because that's when mistake occurs. So take your time. and do not compromise patient safety there. All interview process, they will ask you mistakes and do prepare. And again, rather than focus on mistake, you focus on what you learn from that mistake and what you have changed, your behavior, your professionalism. Also, they will ask you about how do you deal with situation. What was your experience when you had conflict or somebody yelled at you or something? Be prepared to have those questions, but again, always focus on what you've learned from it, something positive that you can answer back. And show accountability and honesty. As a new grad, there will be times that you will make some mistake or misjudgment. Rather than say, oh, is somebody told me, or make some excuses. If you made a mistake, first thing is, okay, I'm sorry. This is a mistake. I should not have, I should have looked into a little bit more or asked. Being honesty really carries long. I had an experience when I started Pfizer. I made a mistake saying to a patient that her hormone level was within the normal range. And I just said, oh, she must be normal. When my attending came back and asked me what happened, I looked and I admitted, actually, it was my mistake. And I was very surprised that he was very warm and very supportive. And we had a better relationship actually after that incident. So show accountability and honesty. And attitude really can make your nursing career or break it. As a new grad, you're fresh out of school, you have lots of good information, and granted, you've got very good education at UCLA, but please, the knowledge you gain from textbook can be misleading at times. So even though you are working with mentors and you have some information, there's a way to share that information without being so-called arrogant. And also when you talk to them about scheduling, avoid saying, oh, I cannot work in the afternoon, or I cannot work night shift. The first couple of years of nursing career, the experience takes high priority, and you may want to be a little bit flexible. So when they ask certain schedules, you want to show flexibility rather than, no, I cannot do that, or no, I can, make an adjustment. So the soft skills, like how you communicate with your colleagues, they really want to see if you can work as a team, because in many careers, especially in nursing, you need to have other nurses and other pharmacists, other teams work together to for the patient safety. So they want to see that, and coachability, whether you're able to learn from your experience and this residency program, rather than being a little overconfident. And how to manage your stress. We are so into taking care of our patients, our parents, our children, or whatnot. But most important person is you. So do take time to take care of yourself as well. And again, what interviewers want to see is willingness to learn and patient-centered mindset, strong work ethics. Don't call in sick. 2-3 times during the first 3 months when you're at probation. That's not a very good thing. And I don't need to say that, but it happens. Also during holidays, if you go to work-related holiday events, that's not a party time, okay? Don't go out and get drunk or say some negative things about other people. Just know that work events are work-related events. So just enjoy yourself, but don't cross that professional boundaries. And when you are not interested in something or someone, they don't ask questions. So during orientation or interviews, prepare some questions you want to ask about the organization or the patient population, so that it shows that you were interested in and you learned something about them and you came here with a mindset of being a part of team member. Oh, this is my graduation picture in 2005. That little girl is my daughter. I'm very proud to say she's a member of UCLA as well. She's currently studying social medicine at graduate program here. So these are 8 oncology students in my program at that time. And among, I believe it was 117 students, and we were 8 students there. A year before our graduation, we were told that we only had 1 oncology nurse practitioner. So there are a couple of things I wanted to tell you in addition to residency program. When you are doing residency program or the first couple of years when you do work, what you're doing is actually getting to know horses. Have you heard horses and
No.
the zebra? So there was
Oh, yeah, tell the story.
Okay, so when I was in the program, we had a lecture from medical school, and a row of chairs were saved for medical students, and they had to pay $50 per chair to attend a class. So I sat the first row and listened very carefully. And one of the things that the professor was telling us, which remained in my career, was horses and zebra.
Okay.
So when you go and see patients, let's say patients are horses, you see patients who have common cold, diabetes, hypertension, UTI, some cardiac issues, pulmonary issues, and this and that. So you see them, let's say 8 to 10 horses a day.
Okay.
And you know who they are. They come in and they leave with prescriptions and whatnot. And one day, zebra walks in, and you don't know who that is. You just know that's not a horse. Okay. So, and that was very interesting point.
Yeah.
So it looks like a horse, but it's not a horse. Why? Because you've been seeing horses. So that's not a horse. And the best part was you don't even have to know that's a zebra. All you have to know is that's not a horse. And that professor told us, then you can go, close the door, behind the door. You can research, you can read books, call somebody, Google, or whatever you need to do and find out what that is, zebra. But first thing is, that's not a horse. Now, that happened many times in my career. Like first time when I saw wound dehiscence after hysterectomy, I've never seen it before, but since I have done a pelvic exam so many times, I know what the forces were, what it looked like, and when I saw this amber fluid is not supposed to be there, and pink membrane that is not supposed to be there, I knew this is a zebra moment. So I called the assistant, have the assistant stay with the patient. I left the room, I run to the attending's office, and I literally screamed at him, "This is a zebra."
Oh.
I don't know what this is, but this is I explained to him, and he goes, "Oh, that's wound, dehiscence." Basically, we had to take her to the emergency room.
Oh, okay.
And I mean, I'm saying, no, operating room, and so that, part again, otherwise her intestine will be out on the floor. So get to know patients, even though you may think is mundane thing, listen to their heart, touch their abdomens, touch their legs to see they have swellings. Oh, one more thing too. The one incident, which was very defining moment, actually. I had a patient who came in for anemia, young lady in her 50s, hemoglobin of 5.6. She hasn't been feeling well. She's been seeing a primary care physician for 6 months, and the primary care physician tracked her CBCs, and last day it was hemoglobin of 5.6. So she ended up in the emergency room and came to see me. She's my daughter.
Oh, okay. Welcome.
Came
See.
came to see me as a anemia consultation.
Oh.
Okay. So the patient looked fine. We transfused her. The common reason that people have anemia is GI bleeding. So we recommended a colonoscopy. Patient was very reluctant because she cannot afford a colonoscopy. She had to pay $1,000. She wasn't happy about it. As she was leaving or finishing the consultation, I I examined that patient, and until I put my hand on her tummy, everything was fine, but her tummy felt like
The rock.
like rock. And with the supine position with knees up, even world-class athletes' abdomen is not like this. And how do you know? Because you have checked patient's abdomen when you do a physical exam. So I couldn't tell what it was actually. I just knew that wasn't normal. Again, it's like zebra moment, but it's a little different zebra, right? So I went back and talked to another physician. And I said, well, I would like to order a CT scan for this lady, but she's very upset. The CT scan will cost $2,000. She cannot afford colonoscopy for $1,000, so I'm not going to order. And the attending or physician told me, if you think, Susan, if you think she needs CT, you need to order. Otherwise, the husband can come back and sue us. This is a private group at that time.
Ah, okay.
So, it's her prerogative if she doesn't want to do the CT, but it's your responsibility to order that. So I did. And I got a phone call from primary care physician who's been following this patient for 6 months. And apparently patient went back to the primary care physician and cried over the fact that I ordered CT and that she cannot afford. And primary care physician was like, do you really think that this patient need CT? And I asked her a simple question, have you ever touched her tummy? And she said no. And I said, you touch her tummy and tell me she doesn't need CT. Anyway, to make long story short, she did the CT. The attending or the physician came back a couple of days later, and he told me, Susan, guess what? That patient had 17-centimeter tumor sitting in her abdomen that nobody knew. it was the tumor that I was
feeling?
feeling.
Mm.
Saved her life, basically. Anyway, so always, I mean, when you do assessment, even though mundane assessment you think you don't need, as a new grad, listen to their heart, listen to their lung, feel their tummy, feel their legs, and you get to know what normal or the horses look like. Okay. Um, all right, I think that's that's good.
Alrighty, thank you, Susan.
All right.
We do have a couple of questions from students. Let me just look at here.
I want to show, can they see Marie?
Yeah,
Okay. That's little girl in that picture.
that picture.
Yeah, I talked to them about you.
Oh, thank you for
Okay.
joining us. Um, let's see. I have a question from Medley Lopez. As a working nurse, how do you balance other hobbies and schooling with such a demanding job? The student plans to go back to school after BSN, but would like to continue working. Do you have any tips for balancing the two?
You mean hobbies or
Hobbies and the RA and an RN job, balancing the two, like
oh,
work-life balance.
yeah. Well, for me, because you work so hard, hobby is very important. You know, when you have day off, rather than spending all your day at home, just watching Netflix, even though you need to watch, you know, if that's kind of get your mind off. But if you have a hobby on the weekends when you have day off, that really gives you extra energy
Mm-hmm.
and connection with other people that who share the same hobby, which carried me through most difficult times.
Mm-hmm.
So if you are into running, you get to run, you get to meet other running buddies. It gives you a sense of goal and share interest. And when you show up at work or at school the next day or on Monday, you feel a little bit more energized. Um, make a plan, make priority. Put it in your calendar. It's not going to happen if you don't put it in the calendar and Saturday comes and you have no plan. So starting a week before, 2 weeks before, you reach out to some people. Oh, you want to go hiking, you want to go running, you know, you want to go and walk around or, you know, walking and whatnot. It's a good time to plan a couple of weeks before and do it
Good.
and make it happen on regular basis.
Great. Thank you.
Yeah.
I know that you touched on this a little bit, but can you elaborate more? What is the most effective way to prepare for applying for new grad RN residentials?
So,
Like if you were to pinpoint like the top three tips.
right. So get ready early. You reach out to people who you want to have recommendation letters, okay? And prepare the letters for them actually. All right. And the second thing is they like a BSL or ACLS or some other the license if it's required, get it done now. And if you need extra training, even though it's not required in nursing related certificate, always is good to have. So do that. I think that will do.
Great.
Yeah.
Cool. Yeah.
And keep in touch with your friends, actually. The friends you make here in nursing program will be your colleagues in your career. Keep in touch with them, cultivate that friendship or that fellowship so that when you have questions later in your career regarding um, relocate relocation or changing careers, you can reach out to them and ask them. I had an incident that a, a friend that I knew from nursing program actually helped me to not to get a job 15 years later. And I've never spoken to her since the nursing school, but when she find out that I was applying job at certain place, she reached out to me and told me.
Oh,
So
that's great.
yeah, so
That's really great.
yeah,
That comes to show about the power of our Brewers networking night,
of course.
you know.
And I cannot emphasize having a study group.
Mm-hmm.
Without the study group that I had at UCLA, I don't think I could have done as well. Seriously, I was able to graduate with honor and with the study group, and I still maintain that friendship
Oh.
even till now. So say hello to your fellow students that we are all struggling, especially, in these days. Have coffee together, have lunch together, and study together after school, because it really helps you to learn a little better. And it was one of the best thing that it happened to me during school year, having that study group.
Great,
So,
wonderful. And one last question, dovetailing into this idea of building community and building your network, what does it mean for you to be a Bruin nurse?
oh my gosh. When I applied to UCLA, I didn't have any option to apply. I was a mom, and I couldn't apply to some UCSF or any place. I was always a proud UCLA supporter. But once I graduated from UCLA, I didn't know that name or the education, the knowledge or the friendship that I gained here carried so far and so much in my life. The knowledge that I gained, not only knowledge, but the the ways they taught me how to obtain information, okay, at school, and the special lecture that we had, and the friends that I met, and the colleagues that I met through the program um, saved me and enhanced my career so well. And it was my dream for my little girl to be a Bruin member, which that dream came true. So yeah,
Yeah,
is I'm very proud of you guys, who is getting education at UCLA. Um, you're in the right place, and your career will take you far. And don't forget that you are Bruins.
great. Thank you, Susan. That was wonderful.
Okay.
Yay. All righty. All right, everyone, we're gonna go ahead and wrap it up. Thank you, Susan, again for your kind words and your words of wisdom. Please join us again in the next quarter when the Alumni Lecture Program returns. Thank you.
All right. Bye now.